Hello again! In the last episode, you learned about risk factors and symptoms of hypertension. In this episode, you will get to learn about different types of hypertension and diagnosis of hypertension. So let's jump right into it. Let's start with types of hypertension. There are two types of hypertension: primary or essential hypertension and secondary hypertension. Primary hypertension is the most common type of hypertension. Most people who have this develop it gradually over time with no identifiable cause of high blood pressure. On the other hand, secondary hypertension is caused by an underlying health condition and is reversible in most cases. Secondary hypertension appears suddenly and causes higher blood pressure than primary hypertension. Now, are you wondering what are the various conditions that can lead to secondary hypertension? These conditions may include kidney problems, adrenal gland tumors, thyroid problems, and certain medications like birth control pills, cold remedies, and even painkillers when taken in higher doses. Now let's move on and see how hypertension is diagnosed. As you might have learned in the first episode, hypertension usually has no symptoms. Hence, regular blood pressure checks are super important to diagnose hypertension. To measure your blood pressure, an inflatable arm cuff will be placed around your arm and the pressure will be measured using a pressure measuring gauge. These blood pressure measurements fall into 4 different categories, namely normal blood pressure, elevated blood pressure, stage 1 hypertension, stage 2 hypertension, and hypertensive crisis. Let's look at them one by one. First, normal blood pressure. Your blood pressure is said to be normal when it's below 120 over 80 millimeters of mercury. Please note here, 120 is your systolic number and 80 is the diastolic number. Second, elevated blood pressure, also called prehypertension. It is when your systolic number ranges from 120 to 129 and the diastolic number is below 80 millimeters of mercury. Third, stage 1 hypertension. It is when your systolic number ranges from 130 to 139 or your diastolic number ranges from 80 to 89 millimeters of mercury. Fourth, stage 2 hypertension. It is more severe hypertension. It is when your systolic number is measured as 140 millimeters of mercury or higher, or your diastolic number is measured to be 90 millimeters of mercury or higher. Hypertensive crisis. This is an emergency. When the blood pressure reading is higher than 180 over 120 millimeters of mercury. Please note, if you get this result when you take your blood pressure at home, wait 5 minutes and retest. If your blood pressure is still high, contact your doctor immediately. If you also have a chest pain, vision problems, numbness or weakness, breathing difficulty, or any other signs and symptoms of stroke or heart attack, call for an ambulance or your local emergency medical number. In the blood pressure reading, both systolic and diastolic numbers are equally important. However, after age 50, the systolic reading is even more important because in a condition called isolated systolic hypertension, the diastolic number remains normal, which is less than 80 millimeters of mercury, but the systolic number becomes high, and this is common in people older than 65. That was all about different types of hypertension and the diagnosis of hypertension. To answer the question, can hypertension cause complications during pregnancy? Stay tuned with ArogyaDrishti. ArogyaDrishti provides you an easy and convenient way to organize, access, and share your medical reports at your fingertips.